The financial uncertainty in rural health care is rampant across Oklahoma, and a growing number of hospitals are facing thousands, if not billions of dollars of debt. At the same time, there are small and rural hospitals that are doing very well, and their keys to success are being shared in an effort to keep rural health care solvent.
Rural hospitals used to get extra money from Medicaid because they see such a large number of low-income patients. Payments that are being phased out now under the Affordable Care Act. Other reductions in Medicaid payments are also impacting rural hospitals' bottom lines because the majority of the patients they treat.
On our inpatient side, Medicare and Medicaid makes up about 75 to 80% of the admissions. On our outpatient side, I would say they're roughly about 50%.
Jim Berry is CEO of Purcell Municipal Hospital, which is one of only 2 municipal hospitals in the state that do not receive a subsidy in the form of city or county taxes. The other is Pauls Valley General Hospital, which is now in bankruptcy reorganization. Dr. Susan Jones is a family doctor who has worked at Pauls Valley General Hospital for 30 years. The hospital is $5 million in debt now and facing the need for major technology purchases. It also has a payroll of 250 employees, making it one of Pauls Valley's largest employers. She cannot see the community without the hospital.
It's too far to go if you're 80 years old and you just have pneumonia or you're dehydrated or something like that. You need to be where your family and your friends that helps you to heal better.
The Pauls Valley City Council met in special session to organize the effort to convince voters that a half-cent sales tax increase is in the best interest of the community. Pauls Valley Mayor Gary Alfred.
It affects the whole town, the economic impact of not having a hospital, the amount of business that has come here, that the hospital played an important part of having one.
After 2 failed attempts to link up with large urban hospitals, the council brought in New Light Healthcare, a management company that specializes in small and rural hospital turnarounds. Jim Clough, the new CEO of Pauls Valley General Hospital, says the community has a good sales tax base and doctors, 2 things that make a turnaround possible.
They're sitting here on I-35, which helps them generate some sales tax revenues for the community. They've got 7 physicians in the community here, which most small towns don't have that.
In taking over a facility in bankruptcy, Clough says one of the first things he had to do was end services they could no longer afford.
We're involved in too many things. We have a home health agency, which I've recommended to the board. They need to sell that. It's a drain on the cash. They operate the communities and almost that serves the county an ambulance service, and the hospital have absorbed the operating losses in the ambulance service.
And shrinking services in rural hospitals appears to be one of the major keys to survival statewide. Craig Jones is president of the Oklahoma Hospital Association.
But rather than their scope of services being this broad, they may be this broad. A lot of them have given up obstetrical kinds of care because if you don't have the volume, you don't have the physicians.
And Jones says as those services shrink, it makes an alliance with a large urban hospital more feasible and necessary.
A number of smaller hospitals affiliate with larger hospitals, either directly where there's direct ownership or leasing, perhaps just management. In other cases, it's just a working relationship.
The Hospital Association is also looking for new ways to help keep small rural hospitals operating.
Oklahoma has, on its statutes, a definition called an emergency hospital. There are none that are really operating in that mode, and in fact, from our standpoint as an association, we're thinking, some small communities perhaps ought to have a facility that can handle the trauma or the emergent situation that comes in.
And as with most new ideas, there are some issues that have to be overcome.
There's not exactly a reimbursement mechanism exactly to handle that. And we're exploring whether or not we could get a pilot program here in Oklahoma.
There may be no other business as difficult financially as healthcare. Avila Williams with Edmond Integris, a new small hospital on the outskirts of the Oklahoma City metropolitan area, says there is another new financial issue they face due to changes in the insurance industry.
and they're actually putting more on the consumer to pay out of pocket. And many people don't understand that, and so when they show up to the hospital, oftentimes, that's the first time they realize what their plan covers and what their plan does not cover.
Hill says another shock at this time of year is when people discover their deductible has started all over again, and so when they show up at the hospital for a procedure, they have to pay up front.
Most people think that's because of the hospital, and it really is because of the insurance plan that they have, and they just are not aware of that.
And Jim Clough says there is a huge difference between what a hospital bills and what it gets paid.
This facility writes off over 60% of each dollar that they bill for, with contractual adjustments with insurance companies, discounts, Medicare discounts, fixed payments under the Medicaid program.
Issues that face Oklahoma hospitals large and small. Pauls Valley has set their half-cent sales tax election for March 4th.